please.
I would. Thank you so much, Mark, for inviting me to this seminar. And thank you, everyone, for coming along to listen to my talk. It's great to see you all. I'm just going to share my screen and introduce my presentation today, which, as you can see, is called The Moral Experience of Life Under Lockdown, drawing on narratives from both New Zealand and the UK, where I've been doing work really ever since the pandemic began. So as Mark was saying, this is a session on technologies, and the key technologies that I'm looking at in the context of my presentation are the non-pharmaceutical interventions that really became the front line of defense against COVID-19, particularly in that very early period of the pandemic. So we're talking pre-contact tracing, pre-testing, pre-vaccine. The main way in which you could stop the spread or slow the spread was through non-pharmaceutical interventions like social distancing and lockdowns. And so these were, in a very real sense, a technology of public health. They were also a regulatory technology in the Foucauldian way that Mark was mentioning earlier, because it's very much about the conduct of conduct. And there's also a sense in which they became a moralized technology, because compliance with these mandates, with these guidelines, with these instructions was necessary for the MPIs to be effective. You can only slow the spread if you have a collective action phenomenon, and the vast majority of people comply with the recommendations that are put in place. And so that meant that from the very beginning, the way in which these MPIs were presented to the public and discussed amongst the public tended to be moralized, to have a moral narrative at their core. So that was often, in the official version, a moral narrative of it's your civic duty, it's about doing the right thing. But there might be others for whom the moral narrative was slightly different. They might see the MPIs as an outrage, or a step too far, or beyond the pale, or whatever it might be. So that's one sense in which I'm interested in thinking about the relationship between narrative and morality and moral experience in this paper, the way in which certain moral claims get embedded in how people think about the technology itself. But I also want to draw on a second link between morality and narrative, drawing here on the work of the anthropologist Cheryl Mattingly, who throughout her career, starting as a medical anthropologist, then moving into the anthropology of morality and ethics, has developed what she calls a narrative phenomenology of social practice. And her basic claim, I can talk about it more in the Q&A if people would like, is that narrative lies at the heart of moral action. All of our lives have a narrative structure. We're oriented to particular ground projects, core commitments that really determine who we are and whether we look back on our lives and say, I lived well, or I lived badly, or I'm ashamed of that. And that's a narrative arc of our moral becoming, with certain conceptions of the good at stake in our lives. And what I found was that in the research that I was doing on COVID, these kinds of moral narratives were front and center about how people were talking about their experience of living through and with NPIs. And so I wanted to reflect in this paper on what the experiences of the pandemic have done for the moral narratives that we tell ourselves and about other people, and what the broader implications of that might be for public health practice. Because one of the key points that Mattingly makes is that events that take place in our lives can lead to what she calls narrative re-envisioning, where we come to see ourselves in a new way, or maybe see other people in a new way. We come to reform our sense of possibility, and we can reframe our commitments. So as I was looking at the narratives that I collected for this study, and I'm going to present a selection of to you today, I was interested in how this narrative re-envisioning was taking place, what was being re-envisioned and why, and what conclusions could be drawn from that. So I'll tell you a little bit about the study that this paper comes from. Since March, the very end of March 2020, I've been leading basically a research consortium of about 17 researchers, and we call ourselves CAROL, Care and Responsibility Under Lockdown. We originate from anthropology, but we also include scholars in public health, scholars in law, scholars in STS, scholars in criminology, scholars in Pacific studies, and we've been conducting a range of different research projects, I guess, research activities. The majority have been qualitative surveys where we recruited participants via adverts on Facebook, Instagram, and Messenger, that meta ecology, and just ask them to tell us things about what they were doing, the choices that they've been making, about how to live through the lockdown and why they've made those choices, as well as broader free-for-all answers where they discussed their experiences. And we got over 5,000 responses in New Zealand, over 4,000 responses in the UK, and we supplemented those with interviews, about 100 interviews in New Zealand conducted by our team, and then in the UK, partly by our team, but also by a broader LSE consortium called the COVID and Care Research Group, where we did some data sharing. And then we analysed these from various perspectives, and we're drawing on those materials in this paper today. So just to give a little bit of context as to what the technologies, the MPIs that we're talking about were, I'm really in this paper focusing on that early phase of the pandemic, because it gets even more complicated as we move along. And in the UK, the initial instruction was to stay at home, just to stay within your household, whatever that was. If it was one person on their own, that was your household. And then from May in 2020, it became possible for some socially distanced contact to take place outdoors. So initially it was just 2 people, then it went up to a maximum of 6. As the pandemic progressed further, and it was clear that COVID wasn't going away anytime soon, it got even more complicated. There were some possibilities for people to meet up in bubbling arrangements or contact each other at work if the workplace had certain regulations. But the key point was there were still very, very heavy restrictions on physical contact, direct physical contact with people from other households. And so unless you fell into a number of very specific categories, even for about 2 years, it was 18 months, it was very, very difficult to actually hug or kiss or touch somebody who did not live in the same household as you. Now, in New Zealand, the approach was slightly different. The initial imperative was to stay in your bubble, a bubble referring to an exclusive social network that agreed that they would only have contact with each other during the pandemic. And that often reflected a single household, but it didn't have to. There were a number of circumstances if people were living alone, if they had childcare needs, if they were deemed vulnerable in various ways, then they could have a multi-household bubble. That bubble couldn't spend time with anybody else, but with the people within the bubble, you could do whatever you want. You could have as much contact or touch or anything as you liked. And then in April, as cases went down, all bubbles could expand a small amount to encompass 2 or 3 households, potentially even more, but ideally 2 or 3. So this was an approach to MPIs that really allowed multi-household contact, but it restricted things like outdoor gatherings and socially distanced socializing. So the outdoor gatherings were a little bit of a grey area, but officially strongly discouraged. Legally, it wasn't clear whether or not they were actually forbidden. And then by mid-May, the virus had been eliminated, so most restrictions on contact had been lifted. So there were similarities. There was a real restriction of contact, but there were some differences in how that was taking place. So against that background, what kinds of narrative re-envisioning did we observe? Well, the first was a set of questions about whether or not people felt they were doing the right thing. And clearly there were some people like this interlocutor here who felt that through compliance with the MPIs, they were doing the right thing. They were experiencing a kind of moral flourishing. So this person would say, lockdown is crap, but getting the virus is worse, and spreading the virus to vulnerable populations, including and especially the indigenous Maori, is worst of all. My choice not to associate with other bubbles is based on my responsibility to not spread this thing amongst our vulnerable populations, indigenous Maori, Pacifica peoples, elderly, those with pre-existing illnesses, etc. So very typical response here, someone who through complying with the MPIs was able to experience a kind of moral righteousness and a moral satisfaction. But then there were other people for whom the situation was a little bit more complicated, and a number of people who felt that actually they needed to offset that broader public health imperative to other competing responsibilities they had to very specific loved ones, which might sometimes lead them to flout the rules or bend the rules in certain ways, often justifying that as trumping the broader COVID imperative. So we see here a person from Wales I lost my mother not long before lockdown, so the loss of being able to go out to entertainment venues, shops, hospitality, beaches, holiday, etc., meant there's been a lot of time to sit and think. My family that was left did keep seeing each other, otherwise we would have crumbled or worse. None of us have had COVID-19. Then another one. My friend, who was very isolated and having a very hard time, asked to meet at a shop where we both got a coffee separately and then talked at a 2-meter distance for 10 minutes or so. It was awkward and hard to stay the distance, but we managed it, and she was very grateful for having the time together. So within these narratives, we see how, in a sense, there's something that motivates, an important moral concern that motivates a bending of the rules, but also an emphasis on how this was being done responsibly, taking precautionary measures to ensure that actually it wasn't going to facilitate the spread of the disease. So those were cases of outright disobedience. But what we also saw was there were many people who felt in the face of this moral dilemma where there were the two competing responsibilities, they couldn't make a clear decision as to what was the right thing to do and ended up stuck in this situation of moral pain. So we have this person at the top who was talking about exchanging some fruit preserves like a drug drop. Even though there was no touching and it was at a distance, I still felt naughty. So having done this nice thing for a friend, sharing the fruit and preserves, there was the feeling of guilt and naughtiness. The second narrative is even more painful. The respondent says, my first grandchild was born just after lockdown started, and I haven't been able to see him. My daughter, his mother, is suffering from horrendous anxiety as a result of the isolation of lockdown. I also have a 15-year-old with autism who wasn't able to sit his GCSEs, that's the 16 exams, and is suffering from depression as a result of lockdown, and an older son who lives 150 miles away that I can't see, who's unemployed and unable to get a job because of lockdown. My mental health is suffering incredibly because of this. I am unable to help my own children, and I live with a constant level of rage at the insanity of this lockdown. So I think this is a very evocative quote for showing how by interrupting the flows of care within the family in service of a broader care and responsibility to the collective public good, this mother feels that her ground project, as Mattingly would say, her core commitment to help her kids has been thwarted. And so this is leading to anger, pain, expressed here through the idiom of suffering poor mental health. Now, linked to that, you can see how these kinds of tensions are not just judgments that get visited on oneself, but can also be visited on others, leading to ruptured relations. I'll just give one exemplary story here. 2 close friendships I've had for 20 years stopped as a result of lockdown. Actually, we've done some follow-up work with this person, and they have completely stopped even now. Both friends accused me of breaking rules and didn't give me any opportunity to explain my side of the story. At level 4, that's the most intense lockdown, I was scolded for taking my mother to the hospital. I'd taken my elderly mother to hospital and was advised by a friend that she didn't want anything to do with me as I'd been near a hospital. At level 3, I was scolded by a neighbour for moving house. Tensions were high, the friendships have been shattered. So this again was a very common story that faced with all these difficult, tricky, competing responsibilities, moral judgments and forms of ethical reasoning that people had to make. Others were not sympathetic, and friendships could not accommodate the tensions and the disagreements that took place over activities during lockdown. So here we see another case of ruptured relations. In this case, they'd agreed to buddy up as a bubble, but then the wife got freaked and it just never happened, and we never talked about it. That was actually quite hard in a sense because they were supposed to be my people. So again, a sense that sometimes people hoped that something would happen, but somebody reneged on a core commitment, and then that led to a sense of difficulty, frustration, and ongoing damage to the relationships. Now, I know I'm short on time, but I do just very briefly want to offer a third type of narrative re-envisioning, which is where people sometimes come to rethink their traditions altogether. And on this, I draw on material that we looked at relating to Pacific funerals. So for the Samoan diaspora in particular in New Zealand, Funerals are a massive occasion. Hundreds of guests come. They're very, very expensive. Costs might total 50,000 New Zealand dollars plus, because you're having to disperse money to all the guests who come, and to ministers and other talking chiefs called matais and so forth. And there's long been a sense that they're just a bit too much of a burden on the Samoan community, because as soon as somebody dies, there's this complex network of money collecting activities that take place. And yet no one's really felt able to move beyond that conventional funeral, because it's tradition and culture, and it would be too shameful to have a funeral that didn't follow those requirements. But then during the lockdown, people didn't have any choice. They had to. And at the height of the lockdown, only people who'd been in the same bubble as the deceased could attend the funerals. And so if somebody had died in, say, a care home, that meant nobody could attend their funeral. And this was often something that led to great senses of moral distress for our respondents. So we see here a Pacific man who was saying, "It was the most difficult time of my life, not being able to farewell my wife as I feel she deserved. I don't know when or if I will be able to get over this very sad time for me and my family." But what was interesting, and against the argument that would say that any kinds of funerary restrictions are a cultural violence, at level 3, when you still had very restricted funerals with up to 10 people, but only up to 10 people being allowed to attend, actually the feedback was quite positive. So we had a respondent saying, "Being able to have a small gathering of people to celebrate one's life who's passed away helped us and my relatives to mourn our loved one, and keeping us all from feeling guilty in not saying our proper farewells to our loved ones who've departed this earth." So there was still a feeling of guilt, but there was also an important sense in which that was offset by the restricted topology of the 10-person ceremony. And what this then led to was some people reflecting in new ways on those older traditions that had long been considered burdensome in the community. So we had a woman in her 80s who was saying, after her sister died, if she'd gone over to Samoa for the funeral, she'd have had to take personal contributions. You look at the costing for all of that, and you think COVID and lockdown wasn't a bad idea after all. So now, whenever my family comes together here for meetings or lunch, that's our hot topic. How do we practice our culture during funerals, weddings, and birthdays in a sane manner that will not impoverish us? And Peter, a 60-year-old pastor, was saying, "COVID for me allowed people to accept the message of being grateful, saving for the rainy days, and living within your means. My wife and I now have a different strategy for our church funerals, stay away from cultural competitions and extravagant show when performing our Samoan culture." So in this case, being able to experience a type of funerary ceremony that had previously been unconscionable, and to recognize that actually it did have certain merits, even as it also carried disadvantages, allowed people to unlock a new way of re-envisioning how they might practice their culture going forwards, precisely because they didn't have to take responsibility for the decision. It was something visited upon them by the pandemic. So we can see how there are a variety of different styles of narrative re-envisioning at the level of the self, the other, and culture and tradition more broadly. So what can we conclude from this? Well, clearly, moral experience is a key aspect of living through the COVID-19 pandemic. And in particular, doing the right thing, not just in terms of the broader collective and the broader question of public health, but doing the right thing in the context of specific relationships matters a lot to people. I've cherry-picked a few exemplary cases here, but it was a theme that ran through the vast majority of responses that we got in these 9,000 survey responses. But what's very striking is if you look at the public discussions of MPIs and the pandemic and COVID lockdowns, often those questions of doing the right thing, those moral concerns, those ways in which policy could help people to live well, was often left out of the discussion. The whole debate about lockdown and the debate about MPIs was very frequently framed as a trade-off between public health and the economy. If you're going to open up, you're going to open up in ways that will kickstart the economy. So you might reopen retail rather than reopening something that would help kickstart people's moral flourishing. If you were looking at something that was more to do with morality, it would be very much framed in terms of individual rights and freedoms, but in a way that was also very much, well, I should do what I want to do, rather than really looking at the motivations and the intersubjective factors that were compelling a desire to exercise a certain kind of freedom or to be able to do a certain kind of thing. And I think this, to me, was very shocking. And after 2 years, it still didn't really feature in public debate how much these social relations, the things that as an anthropologist we see as the bread and butter of everyday life, should be concerns in a pandemic. I really think that they should. And so one conclusion that we could draw is that perhaps in future, public health policies could be more flexible as is reasonably possible, which is a bit of a weaselly, unspecific thing, but as is reasonably possible to help people accommodate moral concerns. So for example, if we look back at what happened in New Zealand, from the very beginning, there could have been more scope for people to have contact outdoors and not feel guilty or naughty if they were having socially distanced interactions. There could have been scope to have some sort of funeral gathering, even at level 4, because all the evidence suggests that the significance of not being able to give someone a proper departure was so traumatic that it's offset, but it far outweighs the infection risks, especially when you consider other things like shared childcare were given a green light. In the UK, there could have been scope for bubble arrangements to be introduced from the outset, so that people who are the most vulnerable, who really needed contact, whoever that was identified as, could get it. But I think there's also a need to look back on now and reckon with the messy moralities of the pandemic. We're talking about what was happening 2 years ago, but the legacies and the after effects of that in terms of people's moral self-narratives remain with us, because that's the nature of narrative moral experience. It's all part of our stories. The relationships that were ruptured are still ruptured. That lady who lost her friends of 20 years standing still hasn't gotten them back. And so there are ways in which that could be supported. Perhaps we need more funding and mental health support and counselling to deal with feelings of guilt or shame or conflict that people might have, intersubjective therapies to help repair ruptured relations. And I think more broadly, public culture should and could encourage greater reflection and understanding of this moment via more complex storytelling that can really help people empathize with the dilemmas that people were facing, to recognize that maybe there wasn't any one straightforwardly right thing to do in some situations, and that wasn't anybody's fault, but we all have to find a way of working with that and moving beyond it. And that's something that the arts can do, television can do, storytelling can do, public inquiries can do, but the social sciences and the sharing of narratives of the kind that I've shared with you today can also help with. And I think that is a point on which I'll conclude. If you'd like to find out any more about the research that we've been doing, this is our consortium website. We've published about 6 or 7 papers drawing on many of the points that I've discussed here today, as well as some others. And I look forward to answering any questions that you might have in the